Hydrotherapy is just pool therapy or aquatic therapy, and it's a modality we use in physical therapy to help people get exercising and moving when sometimes they can't put full weight through a joint or they just hurt too much to do gym exercises. The water has buoyancy properties, and so it takes pressure off the joints, pressure off the limbs as people are doing exercises in the pool. So basically it takes away the effects of gravity, and that helps people rehab when they can't have full gravity through something or when they just hurt too much. Water also provides just a little bit of a different type of resistance. For example, the faster you move in the water, the more resistance there is, and so we can exercise in slightly different ways. I'd say the main one is somebody that has either too much pain to exercise in the gym, so somebody with like an inflammatory condition like rheumatoid arthritis or just severe arthritis where walking on a treadmill or exercising with weights is just too much pain. They can get in the pool and exercise with a lot less pain. Or if someone's had a surgery and they can't put full weight through the joint yet and they need to get moving.
I see that there's these little contraptions.
Yeah.
Can you explain what those are and maybe how you use them?
Yeah. So there's a couple different things in the pool. There's that belt down there. That belt is an underwater treadmill. And we use that just for walking underwater. It can go to about 5.5 miles an hour. So we can do a slow walk or up to even a jog, which is a little different in the pool because you got the resistance of the water. And then these two machines right here that have these metal bars on them, those are current generators. And I'll turn one on so you can see what it looks like. But basically these generate a current, so if somebody wants to practice swimming strokes or if somebody wants to walk against resistance, we can generate a little bit of more resistance and make it a more challenging exercise session.
Wow, so it helps people maybe work up to the resistance of, you know, getting out of the pool and having gravity in the gym.
Yep. And the other benefit of the current is that it's hard to balance in, so if someone's struggling with balance and they're scared to fall, we can do challenging balance exercises in the pool that they won't get hurt doing, and then they can feel more confident once we get out in the gym floor. For the most part, the first couple sessions we start pretty slow because a lot of times you're doing a lot in the water. It doesn't feel like it yet because you don't have gravity. And so you feel pretty good, and then you get out and you realize that you overdid it. And so we start slow, maybe less time than a full session would be, and then we ramp up. But it's a lot of walking in the pool. We do arm exercises. We have arm weights that go underwater. We've got leg weights that go underwater. So that's all over there. Yep.
That's all your equipment. Awesome.
That's all the equipment. And then usually we do kind of a cool down where somebody can float around and just relax in the pool. And we even have jets over there that people can, almost like a hot tub, and on a massage at the end from the jets if they would like.
Oh, awesome. And that kind of helps loosen up those muscles and...
Yep, especially for low back pain. So incisions, if they're not fully closed, then you don't want to get in the water because you don't want to risk the infection. But other than that, most people can get in the pool. We've had people with different monitors and stuff. As long as they're under the skin and they're closed off, the water won't get in there and ruin the monitor. And then even people with oxygen that have to have like a nasal cannula, they can come in the pool and the oxygen hose floats on top of the water. We've done that before.
So it's pretty flexible for
lots of different populations. Yeah, I would say if you're in pain, come get a free consult, and if you're in a lot of pain, come and do the pool. It's correct. Yep. So we can do a 15-minute evaluation where we just talk and see what you've got going on, and then if pool therapy is indicated, we can start pool, or if physical therapy in general, we can start that.
So the consultation wouldn't be in the pool first, it would just be...
Yeah, just in an exam room, and we can check things out and see what's going on, and then go from there. If they want to go through their insurance, sometimes they will need a referral if their insurance requires a doctor's referral to come do physical therapy. Some insurances allow people just to come straight to physical therapy and start, so if that's the case, you can call the front office, or we can always do a cash pay program.